Hello, this video it is regarding access opening in central incisors. So before starting with the access preparation, first we have to understand the anatomy of the central incisor. As you can see, this is the crown portion, this is the root portion. So in the crown, on the lingual side, we have a cingulum. You can clearly appreciate this is the cingulum. Basically, you can see it as a protruded part on the tooth. So now this will be an anatomic landmark for the access cavity preparation. So now for the access, we have to divide the tooth vertically as well as horizontally. So first we have to divide the crown portion vertically in three parts. We have to make two lines and divide the tooth in three parts. Same way we have to divide the tooth horizontally. So this way. So as you can see, we have divided the crown portion and make a grid. Now our point for the burr, it should be the center part of this grid. So basically this point should be the start point where we have to place the burr for access. Now we are going to start the access preparation. The first burr which we have to use for access, it should be round burr. I am using BR31. So I am placing this burr perpendicular to the crown. We have to make a ditch and we should penetrate approximately 1 mm into the tooth perpendicularly to the crown. Now as you can see, we have made approximately 1 mm ditch into the tooth and it's with round burr. Now we have to change our burr from round burr to a straight burr. Now with the straight burr, the angulation which was initially perpendicular to the crown of the tooth, now we have to make it parallel to the crown. So we have to make it further deeper with straight burr. Now I am extending this preparation to completely de-roof the pulp chamber. Now you can completely see the triangular shape access preparation. The tip is towards the cingulum, however the base is towards the incisal edge of the crown. So now I am inserting a 10K file to check the access. So this is my primary file which I am using to confirm my access and to remove the pulp. So this is our access preparation for the central incisor.